Communication between nurses, presented by Catherine,
Zach,
Emma,
Alexandra,
Zara. Project. The problem we have identified and based our study around is a lack of communication between nurses during the handover process. The relevant National Safety and Quality Health Service standard that applies to our study is Standard 6, Communicating for Safety. Our aim is that we will improve patient safety by reducing the incidence of reportable errors due to insufficient communication between nurses by comparing two similar wards at the same hospital for a 6-month period concluding in December 2018. The other people that would need to be involved in the project are the nursing unit manager and associate nursing unit manager of the wards, all nursing staff, hospital facilitators and hospital management.
diagnostics. Poor communication between nurses and in particular insufficient and ineffective handover has been linked to an increased risk of preventable incidents caused by nursing staff. Incidents such as medication errors increase the risk to patient safety, hence there is a link between the quality of communication during handover and patient safety as suggested by Manser and Foster 2011. As noted by the Joint Commission of Perspectives 2012, there is research to indicate that in as high as 80% of serious medical error situations, miscommunication between staff during handover was noted as a contributing factor. It is also clear in the video Learning from Error that the breakdown in communication between nursing staff as they failed to give a clear handover to one another was a contributing factor to the sentinel event that transpired. This helps highlight why in the recent second edition of the National Safety and Quality Health Service Standards, Standard 6 is titled Communicating for Safety. Allison et al. 2013 suggests effective handover of responsibility and information is carried out by ensuring nothing necessary is missed and also that the handover is conducted in a correct manner. An effectively structured and wide-used method of handover is ISBAR, standing for Identify, Situation, Background, Assessment and Recommendation. Originally used inside critical work environments on board nuclear submarines and in aircraft, ISBAR was later adopted and implemented into the hospital system so that handover would have a structured and safe way of being conducted that minimises the risk of important information being miscommunicated or just plain missed. It is proposed that changing the way staff hand over to more consistently and across the board align with the ISBAR method will minimise the errors being made by nursing staff, which errors can often be the result of poor communication. The use of comparative studies between two acute hospital wards, one applying the proposed intervention, the use of ISBAR, and the other continuing on as is currently practiced as the control over the space of 6 months, will set the basis for our studies to find out if the proposed use of ISBAR will help minimise the error resulting from poor communication and help the hospital better align itself with the national standards. The measurement and recording of how effective the intervention is will occur through the collection of regular nurse and management feedback on the quality of handover and analysis of trends and occurrences of error and identification of risks across the wards will be conducted using a Riskman and VIM system.
interventions. By recognising communication during handover as a significant issue within hospitals, there is a number of ways we can implement these changes. However, it is critical to support these changes with correct administration, planning and understanding before the implementation of these changes occurs. Hospital administration is key to the facilitation of policies, standards and procedures to ensure a hospital runs smoothly and efficiently. By gaining the support of key management positions in the hospital that could initiate and drive these changes, we believe could empower a thorough and sustained approach to this study. In addition, amongst these management roles, there has to be a complete comprehension and absorption of the changes on a primary scale within the ward. To do this, people such as nurse unit managers and associate nurse unit managers must aim to guide their colleagues with the right tools and advice to ensure that this plan works at the forefront of their care. By using the proposed change discussed previously, ward staff can utilise an ISBAR sheet that will guide their handover at the beginning of every shift. Provided on the screen is an example of what the ISBAR could be used for during the handover process. This prompts the next nurse on duty who is being handed over to involve the patient and ask relevant questions in regards to the patient's conditions and care that they believe need to be attended to during their shift.
Impact and implementation. The effects of the use of ISBAR on one ward versus standard handover practices have been recorded on a database such as Riskman VIMS. These databases have the capacity for us to monitor incidents and nurse feedback. This platform is beneficial to highlight events where ISBA handover is insufficient and therefore there is a breakdown in communication between nurses. This tool will bring light to events that resulted in a breakdown of communication between nurses so that further investigation can be undertaken to find the origin of the issue that caused the adverse event. The use of this resource will give nurses a safe and easily accessible platform to acknowledge and identify events and situations that did cause harm while at work. Investigating the cause of these adverse events would create a safer working environment that avoids the blame culture of singling someone out, but rather looking at the bigger picture such as perhaps the staff are under time constraints. Furthermore, perhaps this will encourage staff to properly use ISBA handover to avoid being highlighted in an event of breakdown in communication, therefore creating a safer environment for staff and patients.
Spread and sustainability. Further implementation of ISBA into all wards across the hospital. As apparent from our recent study, ISBA was successful in improving clinical communication between nurses during handover. As results showed from my recent study, a 63% reduction in hospital errors during nurse-to-nurse communication, making ISBA the safest and reliable source to handover. ISBA is a criteria that the hospital must follow and it is the standard nurses are required to meet. Therefore, introducing ISBA sheets to nurses, as found previously from our study, was effective in clinical communication between nurses. Also, performing audits to further monitor hospital progress. It is the responsibility of health management staff to set up the audits, making sure that nurses meet the expected level of practice. These inspections are performed regularly and assessed by an assessment team referred by AFRA. The purpose of these audits is to assess and critique the application of ISBA within the hospital service, making sure nurses meet the criteria. The aim of the audits is to enhance clinical communication during handover. As identified, poor handover is a contributing factor to adverse events. Thus, the implementation of ISBA improved efficiency and reduced errors during handover. The audits are beneficial as they monitor and identify areas that require more focus, enabling nurses to recognise the areas they are failing to meet towards the criteria. AFRA will be notified of the results from the audits quarterly, which AFRA will provide the findings on how the hospital performed. Furthermore, AFRA will advise the hospital improvement schemes based on results on their most recent inspection. The hospital will also be provided with a copy of the audit results that will be given to management in the form of summary reports, thus outlining performance of nurses during clinical handover, areas they can make improvements, and any risks that occurred.
You will find the references list on an additional document that we will be providing.